Oh. Or just down. Okay.
Okay, I'd like to do the welcoming remarks. And then after that, I'll do my 903 remarks. And then at 906, my Dr. Garcia remarks. Oh.
So great. Okay, and I'm just going to introduce Clay after I
Is this on? The sound is on? Check, 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 check. Sound okay? My check, my check, my check, my check, my check, my check. Testing 1, 2. My check. Testing 1, 2, 3, 4, 5. My check.
Hey guys, Elmer's not here. It's okay. That's all right. I was good. I need to do something. Okay, well, I'm starting, so try to step down.
Chad, are you organizing service?
I think they are going to get you organized.
She is?
You can be as mean as you want with these council members.
Good morning.
How are you? Clay, hey. Good to see you.
What's up, man? Yeah, you all right? See, you got to deal with this over the key. You're running the full mic. You got some kind of meeting notice you're having. Yeah.
Testing, testing. Okay, if you want to get everybody lined up for this, I could just start talking.
No, let's get everybody behind you.
Okay.
How's she get this? Yeah, she get that one. How's the mayor doing? Oh, he's doing all right.
All right. Good morning, everybody, and thank you for being here. I want to say first and foremost that I'm honored to be here this morning with Judge Jenkins and Commissioner Garcia, two people who have led on the vaccination work in Dallas despite many challenges. It's also an immense pleasure to be here with my council colleagues, Mayor Pro Tem Adam Medrano, Casey Thomas, Paula Blackman, David Blewett, and Adam Bazaldua, who continue to put their constituents first and who are here together to show our support for the continued and enhanced joint efforts between the county, city, and our business community. Let's be clear. We are now getting close to the 1-year mark in experiencing one of the biggest challenges that Dallas has ever faced. We can see the light at the end of the tunnel, but right now, today, we are at the darkest moment. We have thousands of deaths, we have registration challenges, and we have hospitals that are near capacity. In our darkest moment, it is our responsibility as leaders to put our differences aside and to come together as one to forge a path forward back to that light. We have a strong history in this city of public-private partnerships, and that's why I'm especially thankful to have leaders from our many chambers of commerce and Contractors Association and from the Dallas Citizens Council who have joined us to show their commitment to urge our many small and large businesses in this city to get their people registered. Last weekend, when we registered 750 people in Oak Cliff for the vaccination, many of whom walked up to our tents that we had put outside of Jerry's Supermarket, a sweet 90-year-old lady came up to the tent and she said she had not heard about registration before. And because she didn't have her own phone or her own internet, she put down her neighbor's number so that she could get notification from the county when it was her turn to get vaccinated. This showed me that our digital divide is just how bad it is in this city. But more importantly, it showed that it's time for us to come together and to use every tool and every partner in our toolbox to get people registered to save their lives. We all want the same thing, to get this life-saving vaccine to as many people as possible, as fast as possible. And we can only do that by working together. At this point, I'd like to introduce Judge Clay Jenkins, who has been a wonderful partner, especially in helping us get our registration hubs for the vaccination stood up. So I will turn it over to him.
Thanks so much.
Thank you, Clay.
Hey, thank you, everyone. Thanks for being here. And by the way, thank you, Councilman West, and thank you, Elba Garcia, who have led our efforts thus far as actual boots on the ground registering people. I think every day since the registration began, Dr. Garcia and her staff have been somewhere registering people, and we need it because we are going to run out of Hispanics over the age of 65 if we do not increase our registration. So I need everyone's help on this. I want to show you something real fast. I want to thank our everybody behind me here, all these great city council people. They're all doing registration drives. They may already have done one, or they are getting one underway, and we need that. But it's not just limited to city council, right? You should register all your employees. Hey, be a block captain. Register your block. It is easy. You see this QR code behind me? If you take a picture of that with your phone, you'll go to the Department of State Health Services website. You can look at every registration hub in your area. Now, you don't have to live in the county that you are registering in. You can register your employees, your friends, your church members in any place they're willing to drive to. And it's in alphabetical order, so you can't just look at the county. If you look, for instance, at Collin County and you started at C, you'd miss Allen, okay? In Dallas County, there's Dallas County, but there's also one in the city of Garland. So going through there and finding the ones you're willing to drive to, getting folks registered for that is a huge key. We need everyone's help. It's easy to do. I don't know that we have the website up, but when you click to the website, you'll click on a register for vaccine button. You can go to the gymnasium, the church, auditorium, the barber shop. All you need is a hotspot and some computers, and you can start registering people. So help us help you. Thank you all. Thank you business leaders who are here and committed to helping register as well. God bless y'all. And it's my honor and privilege to introduce Dr. Elba Garcia, who, as I said before, every single day, her and her staff are out there trying to register the hardest to register folks. Dr. Garcia?
Good morning, buenos dias. I am delighted to be here with all of you today. Unity is the key to challenge COVID-19. We have seen COVID-19 devastating our families, our communities, our businesses. We are all of us in this together, especially when we see that the Latino community and the African American community have been hurt the most. We know that during hard times, public-private partnerships with faith organizations have helped us go out of the darkest times. So we are here today asking all of you in the business community to come out and help us register people to get vaccinated. It's going to take three things. First one, education. Second, registration. And third, vaccination. We're seeing that the numbers are lagging, especially when we see registration of Latinos and African Americans. We need to change the formula if we want to get out of this pandemic into a semi-normal way of life. And that's what I am so honored to be with all of you, because I know the initiatives are going to be there for every employer to register their employees, for every co-worker to help your neighbor, or to help those partners to go ahead and register. We need to go to the schools to where the young people can help their parents to get vaccinated. As Councilmember West mentioned, sometimes it's heartbreaking to see the divide, you know, the lack of opportunity, sometimes the lack of computers and internet access. We can help each other. And that's why we are here today. It's a call to action. Let's get out and change the rules of the game. Let's get people educated with good, reliable information, register, and vaccinated. Thank you all for being here. Y ahora unas palabras en español. La clave para vencer esta pandemia va a ser que nos eduquemos, nos registremos y nos vacunemos. Lo más importante es que nosotros, los que hemos visto lo que la pandemia ha hecho en nuestras comunidades, en nuestras familias, en nuestros negocios, necesitamos educar a nuestros empleados, educar a nuestros trabajadores y a las personas que trabajan con nosotros para hacer una diferencia. La clave va a ser ayudarnos unos a otros. No podemos seguir con números tan bajos de gente latina y afroamericana que no se ha registrado. Así que hoy le estamos pidiendo a la comunidad de negocios que nos ayuden a educar, a registrar y a vacunar. Muchísimas gracias y gracias por estar aquí. Right now we're going to hear remarks from City of Dallas Mayor Pro Tem Adam Medrano. We will answer questions after we finish. Gracias.
Good morning. My name is Adam Medrano. I'm the Mayor Pro Tem of the City of Dallas. As we all know, COVID has affected us has affected all communities. What we're doing today is urging our business leaders, our organizations, our neighborhood leaders to register as many people as possible, their employees. It's a known fact, you know, guys, that the Latino and African American community are the ones that are keeping our economy in Dallas going. They're the ones that are at the restaurants. They're the ones that are at the hotels that are still open, that are able to function. We need to make sure that we are registering everyone as possible. I would be remiss if I did not mention my colleague, Councilmember West, and Commissioner Garcia, for the work that they started. They came to us and said, we need to get into the community. We need to start registering folks, and they've done that. Commissioner Garcia and Chad West, y'all have done an amazing job registering people in your districts. And I challenge the other council members to do the same. We are setting that up as we speak. Some are already doing it, but we challenge each and every business to register your employees. Make sure that they are registered to get in line. We need everyone to get in line for this vaccine, so we can make sure that they are vaccinated when the time comes. So again, this is a challenge to everyone. Let's all stick together, pull together, and make sure that we're getting as many people as possible registered. Thank you. And now we're going to hear from my colleague, Councilmember Thomas.
Good morning. My name is Casey Thomas. I represent Council District 3. Also serve as the chair of the COVID-19 Ad Hoc Committee for the City of Dallas. Before I make my remarks, I want to make this statement on behalf of Andrea Sanders, who chairs the Oak Cliff Chamber of Commerce. The Oak Cliff Chamber of Commerce is proud to partner with the Dallas Division of Emergency Management to combat the pandemic. Through our participation in this testing program, we understand the significant impact this has had on our community and believe this program will make a difference for those we serve. Unfortunately, due to a previously scheduled meeting, we are unable to attend today. However, we support this endeavor. So the Oak Cliff Chamber is on record being in support of this. We need all hands on deck. We need everyone. Our business community, we stand with them. Our city leaders, we're all on the same page. Our community leaders, neighborhood leaders, we need every beauty shop, barber shop, every local diner, local restaurant. We need everyone registering, helping to register individuals to get the vaccine. Similar to voting, if you don't register, you can't vote. If you don't register, you cannot get the vaccine. So we need in every community, everyone on the same page, working together to make sure that we can end this pandemic so we can get back to life as it has been. All hands on deck. That is the message today. The business community, our community leaders, we all stand, city leaders, we all stand united. We're all working. Many of us are having registration events. I'm hosting one tomorrow. Several of my colleagues, thank you, Councilmember West, for your leadership. Commissioner Garcia, my commissioner, for your leadership, making sure individuals in underserved communities who don't have access to technology have a way to get registered. Let's register today, all hands on deck. And now, next, you'll hear from Dale Petrosky, President and CEO, Dallas Regional Chamber.
Good morning. I'm Dale Petrosky, the President of the Dallas Regional Chamber. I'd like to, first of all, say thank you to County Judge Jenkins and to our City Council members here who have taken a great leadership role in the past several weeks to get the word out, to get people registered to vote, registered to get the vaccine. I'll tell you a little story. Last Friday I was talking to Clay Jenkins, our county judge, and we were talking about registrations, and I was talking about my wife and me, and he said, well, you know, if you live in Dallas County, you can register in Collin County, Tarrant County, Denton County, beyond our area, and you'll have that many more chances to get an early call to get vaccinated. And the minute you get vaccinated, 35 days later, you're going to be 95% immune. You're going to be ready to get back to life again. And I think that's the message. We need to use this moment right now before a lot of vaccines start coming our way. And I know Clay and others are working hard to get the vaccines our way. We need to use this time right now to get as many people registered as possible so that when those vaccines come, we can get those shots in arms, people can get safe, the community can become safe, and we can get back to life again. I mean, everyone wants to get back to the days when people are going to ball games and restaurants and hotels and flying on airplanes. That's what we all want, and we're not going to get there unless we get people registered now, and we can get as many shots in those arms as possible over the next several months. So I would just say that we are delighted in at the Dallas Regional Chamber and our other colleagues with the other chambers to get this information out to as many businesses as possible, because employees trust the information that's coming from their businesses as much as any other place. So we vow to get as much of this information to as many of our people as we possibly can, and we're going to stay on it until we get the numbers up to where they need to be in terms of registration and in terms of vaccinations. So thank you very much, and now I guess it's time for questions. So, or unless somebody else would like to say something. Anybody else like to say something? Yeah, it's Petroskey. Okay. Anybody else, David?
Yeah, thanks. My name is David Blewett, councilman for District 14. I have a bit of a different message. We're here for registration today, and I think it's important for all of us to think about that and thank our civic leaders and our business leaders for helping us with this. But I have a message for Governor Abbott. We have hundreds of thousands of people registered. We're going to have more hundreds of thousands of people get registered, and we have tens of thousands of doses of the vaccine. The truth is, the city of Dallas, the county of Dallas, is the economic engine of the state of Texas, if not the nation, and we need more vaccines. So registration is critically important, but the message also needs to get out there. We need more supply. Thank you.
I have a quick statement from Councilmember Gates had asked me to read this. She was not able to make it today. It is essential we reach everyone and get them registered for the COVID vaccine, and I am thrilled to see elected officials, the community, and business leaders come together to help achieve this goal. This is the time for cooperation and teamwork to tackle the daunting task of vaccinating enough individuals to get to herd immunity. It is the only way out of this pandemic, and we all have a responsibility to do our part. Thank you. I'll take it. Forgot how that worked. All right. I guess we'll take questions at this point and just let us know who the question's for. Yes, sir.
Yeah. Hey, and before I take your question, that didn't speak that are here, Councilman Buzzle-Dua and Councilwoman Blackman are here, and I hope I didn't leave anybody out on that. and many other business leaders like my friend Trey Black are here with us today supporting this. What's your question?
Do you have an estimate of how many people who are over 65 have been given the vaccine? And if so, how is it looking for them? People who, like you said, were talking, have no phones, all that. How's it looking in Metro in that avenue? Secondly, the second question is, if you're an illegal immigrant or non-residential, how do you go about getting the shot? Do you need ID? Tell me about it.
Sure. So the questions, he has two questions. I'm going to repeat them and answer those for you. The first is, do we have an estimate of how many people over 65 have gotten the shot? And the answer, here's what we know, just right off the top of my head. Over 125,000 people, as of this morning, have gotten the shot here in Dallas County. Now, some of those are first responders and healthcare heroes. At this site alone, over 28,000 people over the age of 65 have gotten shots. The majority of those are over the age of 75. At the city of Dallas, by weekend, 5,000 more people over 65 will get the shot. And so there are a lot of people over 65 getting the shot. But for instance, we are going to run out at the current rate in the next 2 weeks or 2 to 3 weeks of Hispanics over the age of 65 because of a lack of registration, which leads in to his second question, which is, suppose I don't have ID. Suppose I'm not from Texas, I'm from Mexico, or I'm here living from Wisconsin. If you are here, you are qualified for a shot at any hub you're willing to drive to. People cannot deny you a shot because you don't live in their area. They cannot deny you a shot because you do not have all of the papers in order to be a green carded or legalized citizen of the United States. If you're here, we have a shot for you, but you've got to register. Does that answer it? Did I get it? There's a lot of them. Okay.
It will help for identification for people who have not documented the particular consulado and what they issued by the Mexican consulate. It will work as an identification.
Yes, that would be great. But even if you're a homeless person with no ID, we're going to figure out a way to get a shot for you. Now, right now, you're going to, with the new registration system that will be at Dallas County, you'll get a QR code, and we'll need to find some way when you bring your QR code to show that you are the person on that QR code. So if you get a QR code for Eugenia Castañeda, and Clay Jenkins shows up with Eugenia's code, he's going to need to show something to show he's Eugenia. That's one of the ways we'll stop this unauthorized forwarding of people using other people's invites for the appointments. Does that answer it? So matricular, very helpful. Bring that.
Second one first. Go ahead.
Okay, so we are at Dallas County, and I think at most of them as well. It is now open for anyone to register. Now, if you're not in 1B, let me repeat the question. The question is, can I register if I'm not in 1A or 1B? And the answer at Dallas County is yes. The answer to that is that anyone can register, but if you're not in 1B, we're not going to be calling you up for a vaccine yet. But let's say you're in 1C. When we get to 1C, it's great if you're already registered you'll be more likely to get your shot faster if you're registered. Even if you're in 2A or 4A, you know, you can go ahead and register. You can register your kids, even though there's no vaccine yet for children. And when it comes about that there is one, they'll be on there. The second question, which I'm going to let my friends answer, say it again so I can say it.
Yeah, I was asking if there was any reaction. What are your thoughts on the latest statistics on the registration?
Yeah.
That 20% of the people who have registered are Latino, 10% are Black. But the goal has been to try and reach those marginalized communities. So at this point, if there are any thoughts on the
Sure. So the question is, what are the group's thoughts on outreach efforts thus far and what we can do to increase outreach, given that in the city of Dallas, 42% of our residents are Hispanic. And registration has been 3 times less than that as a percent. It's been similarly dismal for African Americans, both, whether they just looked at the morning news at the city, but it's also been dismal throughout the county, the region, and the state. And so we've done some things, by the way. We're spending $4.3 million on a call center that should help people without internet, call in. These great people behind me are doing all these registration events. And, also we're getting a new QR code system that will stop people from transferring appointments and bumping other people out. So all those things will help. But I want to let them have an opportunity to answer that because that's what we're here for.
Regarding to the question, I saw the article this morning. Matter of fact, I responded to the author, Nick Garcia. It was alarming but not surprising. I think there are a couple of factors. One is trust. We have to make it known within the African American community that we trust this vaccine, that this vaccine is safe. We need more of our community leaders. We need more of our clergy, faith leaders to say this vaccine is safe. Trusted voices make all the difference. You can quote me on that. Trusted voices make all the difference. And so that's why we're having a sense of urgency. That's why I'm hosting tomorrow a registration drive-up, registration sign-up event. Many of my colleagues are hosting them tomorrow and throughout the week. You can go to DallasCityHall.com and click on the link for COVID-19 and see all of the locations where we're having sign-ups. This vaccine is safe. Quote me on that.
Councilman Thomas, you said that no registration, no vaccine. But are you talking specifically about the government sites, not necessarily a hospital, doctor?
Right. I'm speaking specifically to the sites that our county judge laid out, the fact that you can go anywhere in the county, and we want you to register at those particular locations. Thanks for the clarification.
Has anybody thought of the idea of talking to Mark Cuban or Jerry Jones to have these players start telling the community that this is safe, that they need to register, that they need to stop running around without masks and congregating in these clubs? We went on Camp Wisdom and we started doing a survey. We had 3,000 people all around this corner at Camp Wisdom in Cockerillo, no masks, partying, and then they don't understand why the death rate in our community is so heavy.
Right.
And we have reached out to Commissioner's Court and to some of the council people to come and do personal, announcements that you need to do this and this and this.
Right.
Black contemporary television.
Okay, absolutely. Yeah, I think that's very important. I know that representatives of the Mavericks are part of the regional chamber. And Dale, you may want to speak to that in particular. But in general, yes, we need the thing for us to remember is we need people to register, but we need them to also follow the guidelines of the CDC. Social distance, continue to wear your mask, do those things while we're registering until we can get the vaccine, until we have herd immunity, continue to do that. Dale, would you like to speak to that?
Yeah, I do know that St. Marshall and Mark Cuban very concerned about making sure the numbers for registration in the Black community and in the Latino community are up, and I think that will give all of their resources possible to getting the word out from their players. Again, what Casey said, trusted sources, and people need to hear from those trusted sources so that they believe them and can go ahead and get registered and get the vaccine.
One second, Ken. I want to just elaborate on the disparity of the registrations by race. I think it's important to also emphasize why there is such a need to go beyond the traditional form of outreach, the door-to-door canvassing, the phone banking, the availability for walk-up outreach at these registration hubs are all trying to address what we have seen through data that came out in that article. I also want to emphasize that there's a justified skepticism in the Black community that I hear about from my constituents daily when it comes to the vaccine. And what I explain to my constituents when that is brought up is, I'm not asking you to do anything that I don't ask my mom to do. I've asked my mom to get registered. I've asked her to get vaccinated. The alternative to not getting vaccinated is a virus that we have plenty of data to support is plaguing our community in a way that we know is going to impact us. So just as my colleague mentioned, trust is something that we are asking and we are emphasizing for our minority communities to put into science and into this vaccination, because it's the only way we are going to reach herd immunity or to a point of safety with this virus.
It is, yeah. Unfortunately, Ken, the temporary vendor. Oh, let me repeat. I'm sorry. Let me repeat the question. The question was, are we continuing to have problems with people doing unauthorized forwarding and posting of links, so that rather it being the most vulnerable person that the city invited, it is another person who was not invited and is not on the list. Yes, we are still having that trouble, Ken, and everyone. And let me say, we recognize that there are many, many people out there who desperately need and deserve a shot. And we are not upset with you that you are trying to use a forwarded link to come and get yourself a shot. At the same time, if you're not on the City of Dallas list, which they have a list, if your name is not on there and you show up for a shot, even if you think in good faith that you have an appointment but it didn't come from us, we don't have a shot for you. We only have shots for the 5,000 people that the City of Dallas made appointments with to give them shots. If we give people who have a forwarded link a shot, then that's one shot that some 75-year-old that the city actually has an appointment with wouldn't get. So it's a very frustrating and unfortunate thing, but I liken it to the way that government purchasing works. It takes a while to get a vendor. And so we had someone who had a pre-existing contract so they could do the work, but it would be like your 7-foot-tall center. You need a 7-foot-tall center, but all you have is a 5'10" point guard. He's doing his best, and that's our contractor that's trying to do these appointments right now. He's doing his best. He's real good at being a point guard. He's not great at being 7-foot-tall center. He's going to be replaced next week by a company that does this for a living, that can run this like Ticketmaster runs it, where you have a code that is you. We know it's you. You show us something that says you're Ken Keltoff. There won't be any way for Ken to forward that, and it's going to fix that problem. But for now, we do have that problem. So the important thing for people to know, Ken, is if you didn't get the invite from the city and county, even if you registered and you're able to go on a back link and get what looks like a registration, but your initial email was not from the city or county, you're just wasting your time. You're not going to be able to get a shot at Kay Bailey Hutchison. Yes, yes, and it's very well. It's so Ken's question was, so this is this an example of people abusing the system? In many cases, that is true. In some cases, people don't know that they are not invited on that list. Okay, so for instance, I had some women come by yesterday who were over 65, and they were frustrated because they were not able to get a shot at Kay Bailey Hutchison. And I asked them to tell me their story. And here was their story. Their children found a link and sent them the link. These were two different women, two different families, sent them the link. They signed up on that link, and they thought they had an appointment with the city of Dallas. So if your children send you the link, or your friend says, I already got the shot and I'm going to send you the link, you're not going to get a shot at Kay Bailey Hutchison. We're so sorry, and it's not the city's fault. It's my 5'10" point guard playing center that's tried to put together an appointment system. It's a very good point guard, but not a great center. And we're going to get that fixed next week. But if you show up without an appointment from the city and the county, not going to get a shot.
So is the old database or the old vendor's database going to be seamlessly put in?
Yes, it is. Yes, it is. And so we are sorry about that. One last thing, guys, before we get out of here, just for y'all to know, here's why. Beyond the fact of it's the moral thing to do, and it's the right thing to do for public health, let me tell you why it's so important for people, for Hispanic, for African American, for everybody to sign up, right? Even if you are in an all-white suburb somewhere, if those things exist somewhere, we got to get to 75% herd immunity. And the best way to do that, and that's why I need all y'all's help, the best way to do that is to get shots in the arms of people in every neighborhood, because it's not Emmett Smith or an elected official that's going to convince people shots are safe. It's their neighbor who can hug their grandkids and go play cards and go back to church that's going to convince people that it's safe. So we got to get into every single neighborhood, and you guys have a huge role to play. You have been heroes in this thing. This is not, for your show. This is me talking to you. You've been heroes because what you've done is you've gotten the word out. We need you on this more than any other thing. We've got to get people registered. I'm working like heck, and we talked a little bit about that yesterday, to get us up to 72,000 additional vaccines a week. Okay? If we don't have people on the list, we're not going to be able to get those vaccines out. So we got to get people on the list. We got to get them on there quick. Thank y'all.
Before we close out, we have Harrison Blair with the Dallas Black Chamber of Commerce for a couple of remarks.
Thank you, Councilman. I promise I'll be brief, and I'll basically say what we said in our statement, and that is that the Dallas Black Chamber of Commerce is very supportive of the efforts of the city and the county to get all of our residents vaccinated. We believe that economic policy and health policy are the same at this moment, and we can't really get back to fixing our economy and making it more inclusive for all of our businesses and all of our communities until we are at capacity with the vaccination. So please, if you are an entrepreneur in the black community, please help get your family registered, register yourself, and help register your employees. Thank you.
We're done, right? That's it. We're closing out. Thank you, everybody, for coming today.